Hello, thank you for giving me the opportunity to present some of my PhD findings. I have no non-competing financial interest or personal relationship that could have appeared to influence the work reported in this presentation. So I'm trying to cover part of my PhD study, which is a qualitative study exploring pelvic health physiotherapist clinical reasoning in the UK and the Kingdom of Saudi Arabia while managing patients with urinary incontinence. I know it's quite a challenge, but I am going to cover the main and important findings only. So probably you're wondering why the title is Treating from the Neck Up rather than the Waist Down. It is one of the participants' quote during the interview, and I think she meant to say that urinary incontinence is multifactorial issue that needs to be considered within the management decision. So why have decided to do this research? So, with the studies that have been shown in the literature about biopsychosocial reasoning, they have applied, they were being really limited and they didn't consider the social and psychological factors in physiotherapy research. In addition, there are insufficiency of research in patients' individual culture. All the research in physiotherapy and about individual culture is only mentioned as lists, and they are not covered in details. Patients with minor ethnicities can be reluctant and shy to seek help and talk about intimate and very private body part. So that's really might influence the physiotherapist's decision making. So in addition to that, when we talk about the individual culture, even the organizational culture have been mentioned as a list in the literature and was not really covered very well. So there are limited emphasis on the exploration about the organizational culture on clinical reasoning and decision making. So after exploring the gap in the literature, the aim of this research is to make a comparative study between the UK and the Kingdom of Saudi Arabia and compare between pelvic health physiotherapists, clinical reasoning and decision making while assessing and treating patients with urinary incontinence. So I mentioned that it is a qualitative research, and I have used semi-structured interview in order to understand the participants' thinking process while assessing and treating patients with urinary incontinence, in addition to focus groups. And in the focus groups, we discuss about the factors that influence their decision making. So I was really lucky in order to recruit 28 participants from both countries in the semi-structured interview and 20 participants in the focus groups in both countries. So part of my findings where there are really a range of factors that are related to patients and pelvic health physiotherapists. And pelvic health physiotherapists that include emotional intelligence of the physiotherapist. They use their empathy, their active listening, their rapport in order to encourage patients to talk about their intimate problems that might be related to their urinary incontinence. And they use their knowledge and postgraduate training in order they use them, and they mentioned that they really influence their decision making. And surrounding all that is the contextual factors, and the contextual factors include individual and organizational cultures. So this is the novel part of my thesis. So what is the meaning of individual culture? Individual culture is the group of people who share the same patterns of behavior, such as language, beliefs, values. While organizational culture is not really about the language, it is about the pattern of common beliefs and values that gives fellows of an institute meaning and provides the rules for behavior in their organization. So it is really clear in the comparison between the UK and the Kingdom of Saudi Arabia, the participants mentioned that physicians' hierarchy really influenced their decision making in Saudi Arabia. And they have mentioned that they have limited collaboration within the multidisciplinary team. And while in the UK, it was not really the same case. And the culture was the biggest and important differentiation between the two countries. So one of the participants in the focus group in the UK found that her patient's goal is to not leak during praying, so she used that goal during her management plan, and that helped her patients to improve. So, what I would like to say that clinical reasoning models should acknowledge the importance of individual and organizational culture. So, the next step, there is an urgent need to consider individual and organizational cultures in any attempt to introduce new evidence or implement clinical guidance. If you have any questions and comments, please add them in the feedback box below. Thank you for watching, and thank you very much for my supervisors for their continuous help and support, and thanks to the organization POGB and SIPTA for helping me in data collection.